Good day, everyone. I am Dr. Ahmed Elmasry. I am intensivist from Egypt. Today, our brief lecture will be about the EDIC 2 exam tips and tricks. And during this session, you should be able to think like an examiner and also answer the questions of the exam like a safe intensivist. The learning objective of this lecture is that by the end of this lecture, the candidate will be able to understand what is the EDIC 2 examiners are really testing. And also the candidate will be able to map the station's performance according to the COBITAS competency. And also the candidate will be able to use a structured answer framework in order to success and pass all the exam stations. And also he will be able how to interpret the CVS with the examiner friendly logic, and also to avoid the common station mistakes and pitfalls which might lead to loss of marks. And also how to communicate the answers with a safety, priority, and reassessment approach. So the first thing you need to know what is the exam philosophy. The exam philosophy is that what the examiner need to assess the candidate. The EDIC 2 exam, the philosophy for the EDIC 2 exam, it's not only about the knowledge. We know, all of us know how to manage the patient. And we already have in EDIC part 1 the basic knowledge and too much knowledge how to manage the patient. But the EDIC 2 exam is how to perform this knowledge on the patient, how to manage the patient in a structured approach during the exam. So the EDIC 2 exam, the central concept of the EDIC 2 exam is to that the candidate should demonstrate that he is safe to manage the patient, and he is managing the patient in an organized approach, structured approach, and also a clinically credible. And he should do this within the first 60 seconds of each station of the exam. The examiners will ask himself one question: should I trust this candidate in order to manage the patient, the critically ill patient, in a safe? Is the candidate is safe to manage the patient? Is he is able to manage the patient independently? And if the answer yes, that means that the candidate is having the pass mark and he will be a top performer. So how to be a top performer during the exam? In order to be a top performer, you need to have some requirement. The requirement is to know the exam format, and the exam structure is that it's divided into two stations: the clinical case scenarios and the computer-based scenarios. And according to the latest guidelines, the exam of the clinical case scenarios, it's divided into three clinical case scenario stations. Each one is 25 minutes, so you have too much time during the clinical case scenarios in order to read the clinical vignette and also to prepare your expected questions and expected answers during the exam. The most challenging part is during the computer-based scenarios, and the structure, it's having three sessions, and each session is format of 12 minutes. So here each question will be like maybe like 1 minute. Some questions are very easy, so you can answer the question within 10 seconds, 20 seconds, and you can save this time for the other questions. So the time management during the computer-based scenarios is very critical. So this is regarding the exam format. The second thing that you need to know about the exam is the blueprint for the exam. The blueprint for the EDIC 2 exam is the copy-trace domains. The copy-trace domains is the competency-based training in the intensive care in Europe. It's not a separate exam. It is the domains that are essential in order to go for the exam, and they are assessing your performance based on this blueprint or the copy-trace domains. The EDIC2 exam have 12 domains for the copy trace, and these domains have almost 102 statements. And these statements are the minimal standard for the knowledge and skills and attitude for the candidate in order to pass the exam and to be like a certified intensive care specialist. So you need to know what are the copy trace domains in order to pass the exam. These are the 12 domains for the copy trace you need to know, and you need to have idea about all these domains, because during the exam you will be exposed to all these domains. You will have questions regarding the resuscitations, the initial management, diagnosis, disease management, perioperative care, end of life care, professionalism, communication, and also comfort, recovery, rehabilitation, and also organ support and interventions. So during the exam, you are expected to be asked or any question regarding these domains, and you are expected to answer these questions in a structured pathway. And the second thing is to prepare for the exam. The preparation need not only study, but it need practice. So my approach during the study for the part 1 and part 2, for part 2, I have a daily task. I have a daily clinical case scenario assignment. And for that, I need to recognize what is the life-threatening physiology and prioritize the actions for each case scenario. And also I need to have like daily OSCE assignment in order to interpret the ABG, the ACG, the radiology, the echoes, the curves, the ventilator graphs, and also daily task for the applied physiology. What is very important during the EDIC2 exam, it asks you about the pathophysiology of the disease. So we need to know what is the applied physiology for each disease, like the intracerebral hemorrhage, what is the pathophysiology, what is the expected management based on the applied physiology. And also you need to know, to be aware about the guidelines, especially the recent ESCN guidelines over the last 5 years. I have a one stations a long case scenario about the post-cardiac arrest care management, and it was recently published. It was almost 6 months before the exam. It was a new guidelines. I have a 25 minutes station. You were asking everything about these guidelines, and even they are asking about the numbers. So you need to know all the ESCN guidelines, and you need to study them well and practice them well. And what is very important is to have a mock exam. The mock exam prepare you to be in the real exam situation, and it really help you in order to pass the exam. What is very important during the exam is to build a trust between you and the examiner. So the examiner, if he's not trusting you that you are safe to manage the patient, so you will not pass the exam, because he has a criteria in order to assess you based on these trust pillars. In order to build a trust between you and the examiner, you need to know what are the trust pillars. The first pillar is the safety. You need to demonstrate for your examiner that you are able to save the patient life and treat the life-threatening abnormalities first before going to the diagnosis, before going to the definitive treatment for the patient. And also the second pillar for the trust is to have a structured approach to manage the patient. You have a framework, start from stabilization of the patient, ending with reassessment of the patient in order to assess the response and also to decide the escalation and de-escalation plan for the patient. The third pillar for the trust between you and the examiner is to have a prioritization plan. You need to prioritize what is the most urgent intervention that you need to do for your patient right now in order to save his life. And also the fourth pillar here is the communication. You need to show to your examiner that you are able to communicate with your team. You ask for help. You are communicating with other specialties like the neurosurgeon to get the feedback from them. If you are not doing this, you will miss lots of points during the exam. So what is the success framework? How to organize an ideal answer under the pressure of the exam? In order to have a success framework, my approach is to apply the safer approach. The safer approach make you safe during the exam. You are not missing any point, and you are making the patient safe as well. So the safer exam, it's simply like 5 domains. The first domain is the S, which is to stabilize the patient. You need to stabilize the patient through the ABCD approach and treat first the life-threatening condition first. Then you can go for analysis to interpret the patient data, the physiology, the clinical, and the laboratory data in order to go for the third domain, which is the diagnostic domain. What is the diagnosis or the differential diagnosis? And after that, you go for the next domain, which is the management. And then after the management, you need to reassess the patient. The patient responded to the therapy or not, and you need to go for escalation or de-escalation of the therapy after that. We are doing all these steps every day in the clinical practice, and that's what we need to do in the exam. So the ideal answer should start with stabilization of the patient with a life-threatening condition, then going to the analysis, diagnosis, management, and end with reassessment of the patient, the response, and the escalation and the de-escalation plan. So this is the ideal answer. And the ideal answer during the computer-based session, you need to be trained to have this ideal answer within 30 seconds in order to get the ideal answer because you have time limitation. And for the clinical case scenario, you have plenty of time. So you need to be trained how to apply this safer approach within minutes during the clinical case scenario. Regarding the clinical case scenario strategy, how to get higher score under pressure. So my approach is that during the clinical case scenarios, you have a time. So you have time to apply the safer approach to check what is the life-threatening condition that you need to manage now. And after that, you need to analyze the data, and also you need to check what is the diagnosis, the management, and also to reassess the patient. During the clinical case scenario, the examiner will try to help you, and always you will find the examiner asking you what else, what could be else, what do you think we should do something else? Do you think you should ask for another investigation? Do you need to connect or communicate with other specialties? Always the examiner is there is to help you. He is not your enemy. If he's asking you many questions, you need to know that he is trying to help you. So how to start any clinical case scenario? So you have 25 minutes for the clinical case scenario. So the 5 minutes you need, during the first 5 minutes, you need to read the clinical vignette thoroughly, and you have a white paper and you have a pen in order to write down side notes. This side notes should include what is the your initial impression about the case, what is the severity, what is the life-threatening condition that you need to treat immediately, because this will be usually the first question during the clinical case scenario. What is the condition now and what you need to do? This will be the first question during the clinical case scenario. And during this 5 minutes, also, you need to collect the relevant data from the history and from the labs, from the other investigations like the radiology, the CTs, and you should have a expected questions like here. What is the expected question here? What is the disease severity? What is the priority? What is need to stabilize now? And what investigation you need to do? And what is the definitive treatment? And what the reassessment plan. So this is an example of a case of a clinical evaluation of ICH. So the ideal answer here is that this is a critically ill patient with ICH, complicated with a coma, GCS 7 out of 15, for example. So my priority here, according to the safer approach, is to stabilize the patient. I need to stabilize the patient. So my immediate concern here is to intubate the patient, to mechanically ventilate the patient, and to control the blood pressure and to control the ICP. So this is the stabilization phase. Then I need to analyze the patient data, like the blood pressure, the labs, the CT, the radiology, the X-rays, the echo, anything related to the clinical conditions. Then after that, I need to formulate a diagnosis. So the definitive diagnosis here is the intracerebral hemorrhage. Then what is the most urgent investigation I need to do right now? So in case of ICH, I need to do a urgent CT angio in order to rule out a aneurysm or other pathologies that related to the intracerebral hemorrhage. Like in case of subarachnoid hemorrhage, you need to do CT angio in order to rule out aneurysmal dilatation. Then the definitive treatment here, my initial management is to sedate the patient, to give osmotherapy, to give anti-epileptic drugs for this patient, and then reassess the patient. And you need to communicate with other specialties in order to check what is a neurosurgery plan, there is a plan for surgical intervention or not. So if you have this approach, so now you are covering everything from A to Z. So you write down what is the expected questions that you might be expected to be questioned during the exam, and you are writing down what is the ideal answer for you. So the first question will tell you what is the current status. So you will tell him this is a critically ill patient, ICH, complicated with coma, GCS 7 out of 15. My priority here to do for intubation, mechanical ventilation, and to control the blood pressure and the ICP. I need to do urgent CT angio. I need to sedate the patient, to start osmotherapy and AED, and to contact the neurosurgeon for further intervention. So this is the ideal answer for the clinical case scenario. This is another example, like you have a clinical vignette for a patient with pneumonia, hypotensive, despite oxygen, despite fluid therapy, he's tachycardic, hypotensive and hypoxic, despite oxygen, and lactate is high. So your ideal answer should be, this is a critically ill patient with a septic shock and organ failure in the form of acute hypoxic respiratory failure. My intervention now is to call for help, to assess the patient ABCD approach, and to secure the oxygenation, ventilation, and to establish IV line, and to obtain the cultures, to delay, avoid any delay in the antibiotics, and to give fluid resuscitation and vasopressor if the patient hemodynamics is not improving. So if you analyze this ideal answer, so you will check, you will recognize that you already recognize the life-threatening condition. So this is a septic shock and having organ failure in the form of hypoxic respiratory failure. So this is the life-threatening condition that you need to manage now. And the management start with antibiotics and organ support in the form of antibiotics, source control, hemodynamic management, and ventilation strategy and organ support. And after that, you need to conclude in your answer that you need to go for reassessment. Here we are reassessing the patient through measurement of the lactate, the MAB, urine output, mental status, and oxygenation. And also we should, if you need to communicate with other like a senior physician or another specialty, you need to declare this in your answer. What are the common clinical pitfalls during the clinical case scenarios? That you directly jump to the diagnosis without declaring that the life-threatening condition. You just say this is a septic shock without declaring that, stating that the patient is having a hypoxic respiratory failure, he needs intubation right now. And also you mention long answers, and you don't prioritize the immediate life-threatening conditions. you have a poor communications with other specialties. You need to mention if the patient need multidisciplinary team discussions, what neurosurgical intervention, orthopedic interventions. So you need to communicate with other teams. And also, you don't have any escalation plan and you don't have any reassessment. You need to declare what is your escalation plan, and you need to declare also that what you need to assess the patient response and also the escalation and de-escalation plan. The computer-based scenarios, which is very challenging because you don't have time, and you need to apply your structured approach, like the safer approach, within a few seconds, like 30 seconds during the computer-based sessions. And for that, what will really help you is that you have the daily practice for the CPS via the mock exam. And what is very important during the computer-based scenarios is that if you don't have the answer for the question, skip the question, save this time for other questions. And not all the questions are very difficult. You will find lots of questions very easy. It will take maybe 20 to 30 seconds to get the answers. So the remaining time, you will save it in order to go back to the questions that you skipped. If you don't know the answer, skip the question. Don't waste the time. Go for the next question, and you will find the time to go back to this question again. What is very important during the computer-based scenarios is that you need to know that the visual analysis is a key, and you should go for adoption of the pattern recognition technique. You need to scan and you need to tag the abnormality, and you need to prioritize the actions, and also you need to know what is the definitive intervention that you need to know. This approach is very useful during the radiology and the graphs and also the chemistry sessions and all the computer-based scenarios. You need to scan the text of the chemistry stations. You need to scan the image. You need to scan the graphs. Then tag the life-threatening abnormality. Then prioritize what is emergency, what need to be done now, what is the definitive interventions that you need to do for this patient. Let's say like for the chest X-ray and CT interpretation, you don't need to mention all the details of the chest X-ray and the CT. You just need to identify this is a chest X-ray, AB portable chest X-ray. This is the CT plane, axial view, and need to comment on the lines like the tube, the central line, the chest drain, malpositioned NG tube. You need to comment on this intra-aortic balloon, ECMO cannula. You need to comment on this this issue because most of the time there are malpositions like central line, malpositioned AT tube, and also you need to comment on the chest drains functioning or not functioning. So, and then you need to identify the life-threatening condition which is related to the chest X-ray and the CCD, like the tension pneumothorax, misplaced tubes, pulmonary edema, ARDS, massive effusion, and hemorrhage. After that, you need to conclude what is your definitive management and reassess the patient after the management. I will skip this one. So for the radiology pitfalls, don't miss the tubes and the lines. And also, you need to manage the patient along with description of the abnormality. And also you need to have a plan for the time management. You need to skip the questions that you don't know the answer. And also you need to mention the tension physiology. What is the life-threatening condition right now? Is it a tension pneumothorax? Need intervention right now. And also ignoring the clinical stem, the question, the clinical, the stem of the question. If you are ignoring it, you might miss the correct answer. Regarding the ventilator graphs, you need to the same also the to know what is the pattern recognition. But for the ventilator graphs, you need for ideal analysis, you need to go for the phase-based interpretation. You need to assess each phase of the mechanical press, the trigger phase, the inspiratory phase, and the cycling phase and the expiratory phase. And for each phase, you are expecting to find a abnormality. Like for the cycling phase, you are expecting uh, to see the pattern of the air cycling and the pattern for the delayed cycling. And based on that, you will apply the corrective intervention for that. And also for the graphs, you need to know the pattern recognition for the arterial waveform, the CDB waveform, the capnography, and the rotam and the TIG. You need to know what is the pattern for each abnormality. And based on that, you are expected to know what is the intervention that you need to know. And for the chemistry station, you need to know the expected abnormalities that you might find during the chemistry stations, like life-threatening hyperkalemia. And for that, you need to have a life-threatening immediate intervention, like to give calcium, to give dextrose insulin, to give sodium bicarb, to go for dialysis. You need to diagnose it and to manage it accordingly. For the exam, you need to have a strategy for the time management. The strategy that might help you for the time management during the clinical case scenario is to go for the pattern recognition and the scan and tagging and prioritization and intervention approach. You need to scan the image, tag the abnormality, prioritize the action, and do what is the definitive intervention for this one. And also the visual analysis approach might help you in all the stations, like the radiology, the images, the graphs, and the waveform. You need to know the pattern that is the pathogenomic pattern and the corrective intervention for this one. And also you need to know what is the life-threatening intervention, like airway, the severe hypoxemia, shock state, the life-threatening arrhythmia, hyperkalemia, raise the ICP, and also major bleeding and coagulopathy. And for each life-threatening condition, you need to know what is the interventions that you need to do. For airway failure, you need to declare that you need to call for help and prepare for intubation and check the attitude position, confirm the tube position with capnography after the intubation. For the severe hypoxemia, you need to administer 100% oxygen, apply recruitment maneuver, and in case of tension pneumothorax, you need to drain it with ICT. In case of shock state, you need to assess the patients by the hemodynamic monitoring tool, either it's basic or advanced, to check the patient fluid responsiveness, to apply the vasopressors, to check the cardiac function, and also to check for any possible source of sepsis and to control it, like also source of bleeding to control it. Same apply to other life-threatening conditions. You need to know how the examiner is assessing you during the exam. He has a checklist. He asks himself multiple questions, and based on this, he give you the mark for each question. The first question he asks that is the candidate is able to recognize the main problem and the life-threatening conditions. If you did not recognize it, you will miss a point. And the second question is the candidate is able to prioritize the life-saving actions, and he declared it and he did an intervention for it. If you didn't do, you will miss a point. And also, did the candidate interpret the data correctly in the context or not? If you did it, you will get a point. If you didn't, you will miss a point. The same also for the practical ICU management. The same also apply for the reassessment of the patient after applying intervention, and also to define the escalation and de-escalation plan. These are giving you points during the exam. You need to mention all these details. You need to mention in a structured approach what is the life-threatening condition right now, I need to do this intervention right now to save the patient life. You need to declare that you, according to this laboratory data and according to this imaging, the diagnosis is this is the diagnosis, and I need to communicate with other specialties in order to manage the patient properly. And after that, I need to reassess the patient. So the final message is that the EDIC 2 exam, it's not a knowledge exam, it's a performance exam. You need to convert your knowledge into a safe, structured, and prioritized performance in order to pass the exam. So for that, you need to think like an examiner, and also you need to answer like a safe intensivist. Thank you.